Well, why don't I start by making some introductions. Welcome to all of you who are on now, and those of you who will be joining. My welcome in advance of you joining. I'm very excited that this is our launch for the new evening Department of Radiology and Medical Imaging Keynote Lecture Series. This is our evening plenary series of esteemed speakers from all disciplines, from all over the place. We hope some international speakers, but most importantly, we are starting right at home with Dr. Penberthy. Professor Penberthy is going to talk perhaps to one of the most important topics that we'll have in the entire series, which is resilience in healthcare. I think we're finally learning as physicians years too late that in fact we do suffer from these issues, not just pandemic related, but burnout as part of being healthcare providers. And I want to point out just some of the more important examples of Dr. Penberthy's scholarship. I was looking at one of her recent papers looking at actual methodologically demonstrated effects of mindfulness techniques in emergency room physicians and their coping ability and also their interactions with patients and managing stress as well. A lot to be learned for us. Professor Penberthy completed her fellowship in the Department of Psychiatry and Neurobehavioral Sciences at UVA, 1998 to 2000 in behavioral medicine, and is the founding member of our Contemplative Sciences Center, and has focused on therapeutic components of contemplative practices like mindfulness and a variety of psychotherapies, and also directs the effective coping communication skills for physicians, which is not just at UVA, but it is a national CME program focused on interpersonal skills of physicians. She's a professor here and has been since the year 2000. On behalf of the entire department, we're so grateful to you for speaking to us tonight. And with that, I'm going to mute myself, and the floor is yours and control is yours. Thank you.
Wonderful. Thank you. It's been nice to see everyone, and I'm very appreciative of the invitation and being here. I'm going to share my screen, even though I really prefer to look at your faces, but that's okay. We're gonna have time to talk at the end. I am going to talk about resilience in healthcare, and I thought this was important because I want to focus on the positive and what people are doing well and how we can do it even better. I'll tell you, I don't have any disclosures except those that Ziv just shared. I'm very invested in this work, and just love working with helping people do what they love and do it better. So we're going to talk tonight about resilience, and I'm going to keep coming back to that word because that is a big part of what will help you keep going, what will help with prevention of burnout. Tonight we're going to focus on how to define resilience, what its components are. We're going to describe the stress continuum and some of the zones that we think about with that continuum. And most importantly, we're going to talk about these 5 human needs that we all have, especially in times of stress, and some strategies to promote resilience that grow out of those needs. So I want to start though with first sort of just checking in with yourselves. And I like to do this at the beginning of my therapy sessions, my coaching sessions, my lectures, to really give people time to take a deep breath, to let their mind catch up with their body. Your body's here. It's 8 o'clock at night. You've probably had long days. So just give yourself permission to let yourself catch up with being present, and just think about, how are you doing? Literally, honestly. These are some images I just pulled off the web. The one of the woman in the blue on the chair crying is a real picture from the news, a nurse working with COVID. So many of us may not be doing so well. That's why we're talking about this tonight. The first step is really checking in with yourself. How are you doing? Part of what I asked you to do in preparation for this this evening was to do some assessments of how you're doing. And that's going to be informing some of the conversation tonight as well, the feedback I got from you. So thank you for doing that. You can also just check in with yourself. And this is really important to do periodically because it all starts with, are you tired? Are you hungry? Are you fatigued, exhausted, angry, that sort of thing. Just checking that in. So after that, you can pause. And as I said, really let your mind catch up with your body. Often you can do this with just a breath in, a breath out, settle, feel yourself in your body, relax, attend, be present. Now that we're all here, maybe more of us have joined, we've taken time to settle in, take a deep breath. I'm going to just tell you the bottom line up front. I remember my father, who's a surgeon, always said, you know, tell him, I'm sure he didn't make this up. I know he didn't, but he'd say, tell him what you're going to say it, and then tell him what you said. So this is the first part of that. What we're going to cover, bottom line, healthcare, mental health care, that work is stressful. It's stressful, bottom line, and it's even more stressful for some. We'll talk about that. Stress creates challenges and risks for people, individuals, and teams, entire organizations. Stress is a risk. Stress is a manageable risk. There are tools to address stress and promote resilience. Using those tools and getting through the stress is what we call resilience. So if you think about it, you can't have resilience and effective coping without stress. So stress is there. It's going to be there. The idea is to be resilient in the face of stress. That's what we're going to be focusing on tonight. So at UVA, you may or may not be aware of this, but we have a general approach to improving well-being. It's involved throughout all of our systems that help support this. So through FEAP, through the BWISE program, through the coach program, through the physician or now clinician wellness program, the focus is multiple on improving caregiver well-being and creating a culture of wellness and doing our best together. There's three components that we generally think of. Enhancing resilience. One of those is what we're talking about today, and that is a focus on prevention. The other is identifying and reducing unnecessary stressors in the environment. We know that stress doesn't come just from us individually, it comes also from the environment. And then the third is recognizing when the stress is there and teaching people how to respond. So we're going to focus, like I said, on resilience tonight. And we start with this idea of the stress continuum. What we know about stress is pretty robust. We've done a lot of research on it. We know that it is along a continuum. There's no such thing as no stress. We know there are optimal performance areas. So if you have zero stress, as you see in this outline here, you might get bored or be less motivated to do your work. So you need some level of moderate stress to sort of get that optimal performance. However, too much stress, so over there getting into that yellow zone, creates strain, and this is what we think about where you might have had a prolonged period of stress. And then finally, burnout. This is a stress injury where you're not functioning anymore at a level that you should be because of the stress. So the sources of stress injury are multiple, and we know stress is necessary. It's essential for resilience, as we just talked about, for growth and development. Often it's required to get new skills or meet challenges or adapt, and yet it can be toxic. So stress can lead to distress, functional impairment, ultimately misconduct, abuse of substances, and ultimately mental disorders. So what we're looking for is not to eradicate stress, but really to mitigate it. we talk about stress injuries occurring because of specific threats or losses or conflicts, and as well for just a everyday wear and tear. So there are multiple sources of stress. Here's some of the common ones we think about: traumatic injuries, grief, moral injuries. This is increasingly common in medicine. These are situations where you feel stressed because you are having your moral values violated. You might want to do a certain kind of treatment or approach a situation a certain way and not be able to because of constraints and that makes you feel very stressed. And of course, we all are familiar with the accumulation of stress, just long, hard days, difficult, challenging cases, that sort of thing. How big is the problem? I probably don't need to educate you on this. However, I think it's important to understand how important it is, how big it is. This older survey showed 54% of practicing physicians currently meeting criteria for burnout. That is astounding. And that's 2014. That's before COVID, long before COVID. I imagine the numbers now. Also, what's astounding is almost 80% of distressed physicians had never thought about seeking professional help for distress or burnout. So we've got a lot of distress and little help just sort of naturally occurring. As we talked about, stress is necessary and it's very complex. So we talked about the different kinds of stressors you might have in your career right now. What we also know is that some of you may have additional stressors. So these are things like what we call adverse childhood experiences. This is early trauma. We know this makes you more vulnerable. Other characteristics that increase vulnerability to stress. So that might be personality styles, things like that. There may be ongoing stressors in your environment that are not related to work. Stress at home. Ongoing cultural stressors, biases, if you're a member of a minority group, sexism, ageism. So those are sort of the day-to-day stresses. And then if we have a lack of skills to mitigate this stress, if we're not well versed in effective communication skills, this all augments our stress. So it's important to remember the stress we have at work is there, and that's prevalent. We all have that. And then some of us have even more because we've got these other things going on. And it impacts us in very complex ways as well. Stress doesn't act uniformly, although we see that bell curve. We know acute stress can result in an enhanced immunity, enhanced memory. It can maybe help you. However, the chronic or prolonged stress really is detrimental. It has negative cognitive, learning impacts and immune response impacts. So chronic stress is what we're really trying to mitigate. So how stressed are you on this scale that we administered? We administered something called the perceived stress scale. This is very commonly used when you're studying stress. And so you see on the right side of the slide, the scores, the criteria for scoring, and you see your department for the folks that filled it out. Now, granted, this may be a biased sample because people self-selected to fill out the questionnaire. We had a good turnout, but I'm sure we didn't have everybody. So the average score for radiology was 17. That was in the range considered to be low stress, or no, sorry, moderate stress. I can read correctly. So it's there between 14 and 26, so moderate. Someone had a low of 10 and a high of 25. So you've got people sort of spanning that stress continuum, at least by this report. I'll tell you the average score in our program that is for effective communication skills for clinicians. This is the national program that Ziv talked about. The average score there is 25. So those folks are scoring, you know, I didn't do an analysis on that, but that might be statistically significantly higher than your department, the folks who filled it out. So it'll be interesting at the end to see if that feels accurate, that moderate level of stress. So we conceptualize this on the stress continuum, and we're trying to implement this more consistently at UVA. We would put the 17 probably somewhere or orange zone, so the moderate stress. And that's what we would expect for people who are working in the kind of job that you're working in. You're not going to come to work probably and be in the green zone. Green zone is when you're on vacation, you're relaxing on the weekend and you're not on call, that sort of thing. So you see here some definitions sort of to guide you for thinking about that continuum. And again, what we're talking about is that resilience is not necessarily that you have to stay in the green zone, but that you recognize where you are. So that's that check-in. Where am I on this level? That you're thinking about that throughout the day, and you're anchoring yourself. You're saying, where am I on this scale? And that you then can identify where you are and use strategies to sort of get back down to a lower level of stress, so to speak. So you see here, green is ready. That's when you're healthy, you're well, and you're going to have routine stressors. That's going to happen. So like we saw, many of you are in the yellow or orange zone. So you're more drained. It might be at the end of the day. You're having a bad day. The resilience strategies that we're going to talk about will help you get back down to the green zone. Or if you're in the orange zone, you're now more symptomatic and distressed, using some strategies again to get back to the yellow zone or the green zone. And certainly if you're in the red, you might have someone intervene to get you help, because at that level you're injured and you may not even recognize how stressed you are or the impairments in your functioning that you're having because of it. So really promoting resilience is how we're thinking about this, so that you're going to be moving back and forth on the scale, and it's going to be guided by not just your reactions to the environment, but also by you understanding where you are and using strategies to reduce your stress. That's called resilience. So it's the process of adapting well in the face of adversity. And as much as resilience can involve that bouncing back, that reduction of stress, there's also profound growth that can come out of it. This is what we think of as post-traumatic growth. We're not going to be talking as much about that, but remembering that resilience is really growing because of the stress. So we also assessed your resilience as a whole of the people that completed the second questionnaire, which was a resilience measure. And you'll see here that, again, this has been measured a lot. We have a lot of tools to do this. The average score for your department, for the folks who chose to fill it out, was 17.5. And you'll see the scoring criteria. So that actually falls in the category of low resilience. You'll see moderate resilience and high resilience. So the higher score equals greater resilience. That's not something that this is not a measure we typically assess in our other programs. We've really just started conceptualizing resiliency this way with the programs we're using. So I don't have a comparison group. For all I know, you might be doing a lot better than many of your colleagues. But that's just something to think about, that this might be a really handy program to have. Maybe Ziv was a genius in orchestrating this, because the nice thing is that resilience can be learned. What we're going to be talking about for the remainder of tonight are strategies to learn resilience. So, you know, we might come back in a couple months and measure this, and perhaps if you've used what you learned tonight, your resilience score would increase. So I want you to feel more positive about that. So how we're going to address resilience, again, is in this context of stress. When we're stressed, there are some essential needs that need to be met to promote this resilience. So effective stress interventions are going to do one of these 5 things. And this is really helpful to think about for yourself. It's really, really helpful if you're a leader or a teacher of learners to think about how you can promote these for your learners, for your the people you supervise, the people that you work with, and for yourself. So you'll notice when we go through the strategies, they're going to generally fall into these categories. So promoting a sense of safety, calming, connected, that's sort of a social connected or team connected, a sense of self-efficacy, which then leads to this collective efficacy, and promoting hope. Each of these are ways to build resilience. So safety, if you think about it, common sense wise, that makes sense. That's paramount. It's paramount for learning. It's paramount for feeling like you can take risks, do good work, push yourself. So how do we promote safety? We do this literally by checking in and assessing needs. We do this by supporting others and accepting support from others. So every time you work with a colleague and you say, "You doing all right? How are things going? You have what you need." That is a safety check, and that is really, really helpful in promoting stress reduction and resilience. We're going to talk about specific ways to do that. So if I can get my thing to move again. Promoting a sense of calmness can help promote safety. If you think about it, if you've ever worked with anyone who is panicking or getting really stressed out, one of the best things to do is help them calm down. It's a very effective way to help them feel safe. You can ask them to literally just take a deep breath. 1 or 2 or 3 deep breaths really helps reduce that physiological arousal and can help someone sort of calm themselves psychologically. You can provide strategies for someone. You can say, "Breathe with me. Let's do a 4 square breathing exercise," where you breathe in for 4 seconds. 1, 2, 3, 4. You breathe, you hold it for 4 seconds. You breathe out for 4 seconds, and you hold for 4 seconds. You can pursue mindfulness. You can ask someone to help, just to focus, just focus on your breath. Just focus on grounding yourself in your body, similar to what I did when we first met, just letting everything settle down. So this calmness is really, really effective. So I want you to realize a lot of these tools you may do. You may think that they're too simple or straightforward, and yet they're what in the literature we know helps promote safety, which then helps promote reduction of stress and promote resilience. So please advocate for these. Something as straightforward as the gel in and breathe, which I'm sure you're all familiar with. This is literally a technique of just every time you gel in, you take a deep breath and you let your mind catch up with your body before you do the next thing you're doing. That really helps calm people and again, reduce that stress. Another technique when things get tough, especially you're stressed, use this technique called stop. It's called that and because we can visualize a big stop sign. Often when we're really stressed, we need every cue we can to help us because we forget these things. So thinking about that stop sign and knowing that stop means stop. Pause for a moment. Take a deep breath. Observe what's going on. These are all things we've talked about. We're just putting them together. What are my goals? What am I about to do? What am I trying to do here? What are my choices? What do I really have control over? And then proceeding with awareness. So this stopping, this grounding is just a beginning point to then sort of move to the next thing. But it does help reduce the stress. It helps increase that feeling of safety. And a check-in. this is really taking this pause or this a feeling of safety and reaching out to another person. Observing if someone else is stressed. Is our colleague stressed? Did we walk into a room feeling okay and now we feel this tension because our colleague is stressed? You can observe that and state that and ask about it. We might have forgotten in this day and age that it is okay to check in on someone else, to ask them, how are you doing? You look stressed. Is everything okay? Just a simple, straightforward check-in with someone. And you can ask them, do you need help? I just noticed because you seem more anxious than usual. You can just ask them, is everything okay? What's going on? And then maybe respond. If they say, no, I'm fine, you know, okay, well, I'm here if you ever need to talk. Or if they say, yeah, I'm having a really hard time, then, you know, proceeding with a response that you can, you know, what can I do to help? You know, can I help you figure out what to do next? Do you want me to take over while you take a quick break? So remembering that it's okay to help not just yourself feel safe, but if you notice someone else stressed, one of the first things again is to help them feel safe. You can feel safe when you think someone's got your back, when someone cares. So whatever way that works for you, and this is really going to be much more individualized. Some people feel comfortable saying, hey, are you doing okay? Some people feel like they have to make it their own. They have got maybe use different words. But really giving yourself permission to feel safe and to help other people feel safe. Those will definitely reduce stress and promote resiliency. That leads us to this next piece that is really connected. And that is that feeling of connecting with others, that you are supporting others, that you're accepting support from other people, and beginning to really understand and think about your impact on other people and their impact on you. And this can be really a helpful way to promote that compassion, that compassion is a step beyond empathy. Empathy is being able to put yourself in someone else's shoes. Compassion is being able to do that and then do something about it by either, you know, connecting, helping someone feel safe, or something like that. So that really seems to be much more effective than empathy alone in helping connect with people. Again, the goal here is to use strategies to connect, you know, the old I got your back sort of thing, really helping people feel safe that way. We can do that most effectively by a very simple strategy. It's simple and it's hard. It's assuming positive intent. And if you think about it, if you are engaging with other people, there's a lot of stress. Either you're stressed, they're stressed, you're both stressed. This can be hard to do. What it is literally is avoiding negative biases, improving communication by assuming that people have positive intent, that people are showing up to do good work, to be collaborative, to serve the patient the best they can. We often forget this as well. Nobody at UVA signed up to come to work to make you angry or to do poor patient care or to screw up. People come to UVA to do good work, to teach effectively, to provide good patient care, and trying to remember that will really help with this assumption of positive intent. So when someone does something you don't understand or you don't agree with, take a stance that they think about. They had a good reason to do this. I'm going to assume there's a good intention here, and that allows you then to be in a place that's safe, that feels approachable, and you can ask yourself, I wonder why, let me understand. So this gentle curiosity of assuming positive intent can really help everyone feel much safer, communicate more effectively, and be resilient. Another way to do this or to think about it is inquiring instead of judging. So instead of jumping to conclusions, really trying to think about again, what might you be missing if you walk into a situation that seems wrong? How can you approach it so that people feel safe, the stress levels reduced? Part of that is just sort of using inquiry, assuming positive intent, and gently sort of trying to ask, what's going on? Is there something I can help with? I don't really understand what's happening here. Can someone explain it to me? And remembering to bring that into your own awareness so that you're not automatically judging people, but instead approaching it with this curiosity, which feels much safer. We think about this interpersonally as a natural way to get people to respond in a friendly, safe, helpful way. I'm not going to go into a lot of detail about this diagram, but this comes from interpersonal theory and has decades of research on the impact of people upon each other. And what this shows is over in the hostile side, that's in the red zone. We often react in a hostile way when we're very stressed. And guess what? The arrow back on itself is that's how other people respond when we're hostile. It seems like a no-brainer, but we forget about that. If I go in and yell at someone because I'm upset and I'm angry, or I use a sharp tone with a learner, guess what? The automatic natural response is for them to be hostile back. Now, they may not act on it, but they will feel it. And so this is very important for us to know that all the things we're talking about to reduce our stress help us get into that nice little box there in the middle called neutral. All the strategies we've talked about help you get to neutral. It's a resilience stance. It's a place where you can feel safe, and it's very comparable to what we're talking about here. So just recognizing that when I'm interacting with other people, they are going to be responding to me. And if I'm stressed and perceived over in that hostile realm, that is going to be what's pulled back from them. And it's not because they're a bad person, it's because those are the rules of how humans work. And if you look over at the friendly side, it works the same way. Generally speaking, when we're friendly and kind to other people, we get the same back. Now, it's not 100%, because you might have someone who just had some very negative, bad experience and they're over on that hostile side. But for the most part, it's going to be more effective to be on the friendly side, and especially to be able to get to that neutral place. So again, I'm not going to go into detail here. The idea, though, is to understand that your stance is going to have an impact on other people, and it's going to be not negotiable. That will happen. And so it's best to be aware of it and try as best you can to reduce stress for yourself and the other person. Compassion, we've talked about a little bit already. This is another strategy in this reaching out, companionship, connection portion of resilience. So this requires noticing the suffering of other people. This is why it's important to be able to get to that neutral place where you can check in with yourself and understand what's going on in the environment, treating other people with care and understanding, trying to move to that friendly side like we talked about, and seeing the experience of others as part of a larger human experience. We're all in it together. The next component we talked about to promote resilience and is efficacy. This is so important, especially when you're talking about learners, colleagues. So people feel more safe, and they are more resistant to stress when they feel efficacious, when they feel like they can handle their work, they've got the stuff they need. Now, some of this is going to be out of your control as a leader, a boss, or even for yourself, having the equipment you need, having all of the tools necessary is not always within your control, but to the extent that it is, trying to be mindful of that. And especially with the people that you're collaborating with, check in with them. Do they have the information they need, the training they need. And if anyone here is in leadership positions, this is extremely important. That, you know, that information includes communication, timely, clear, ongoing communication. And also it can mean to display vulnerability responsibly. What I mean by this is going back, I mean, all of these are related. So it's going back to that check-in. It's okay as a leader to check in with people and say, you know, are you doing okay? I'm struggling. It helps people feel safe and understand that you're working hard to promote efficacy for yourself and for them. It also helps with efficacy to think about what we have control over and what we don't. We touched on this earlier. Helping people focus on the things they can influence and let go of the things they cannot, and know that difference. So we feel more efficacious if we're focusing on this middle part here, the circle of influence, instead of banging our head against a wall of this circle here, things we might be concerned about and yet we don't have control over. And heavens knows there's plenty of that in our jobs across the nation. There's plenty of that in hospitals, not just UVA. So understanding that the stress we have, yes, part of it is going to be not under our control. How much protective equipment we have, if there are furloughs, those sorts of things. And yet there is a chunk of it that is under our control. And if we can focus our efforts on that part, it reduces our stress, it increases our feeling of efficacy, and we're more resilient. So there was one unit at the hospital that started a practice of take one and leave one. That's what they called it. So before staff leave, they choose to themselves, so they don't have to disclose, they just choose to themselves on purpose one good thing from the day, and they take that with them home, and then they leave one worry at work. And again, this seems so straightforward. It's not easy to remember to do, and yet it's very powerful. Focus on the positive, focus on what you have control of. That circle of influence or circle of control. What can you do something about? And it's going to feel much, much less stressful if you focus on that. In psychology, we call this means-end thinking. You think about, what is my goal? What am I trying to achieve? Maybe my goal is to have the instruments I need for a procedure. So then you think about, what's the best means to achieve that goal? Is it in my circle of influence? How could I bring it into my circle of influence? That's the other thing. You can grow that through collaboration, through effective communication. How can I make these things happen? You have to decide though, are they realistic? Do I have control over them? And who is best situated to help me with this? When is the best time to address this? All of these things will help you set realistic goals, understand how you're working towards them, and feel more efficacious whether or not you get your goal. Most often you do increase your goal achievement, but even if you don't, you often feel better about it because you understand what's going on. So that's means-end thinking. And our final of the 5 categories of strategies to use to promote resilience is hope, building hope. And confidence. So this is taking that goals we just talked about in means-end thinking a little bit further. So thinking about goals that you want that are value-based, really including, you know, what's important to me, why did I come into this job to begin with, and how can I base my goals on those values. I often talk to people about creating what I call a mission statement for yourself. And we often have mission statements at work or mission statements at home in our personal life. And that might be something like, you know, I want to be a good mother. What does that mean, practically speaking, and help build that in my values, my mission statement. We can do the same at work. And so really thinking about these goals and moving towards them helps build not just efficacy, but hope. We can improve positive affect. This is a theory called the broaden and build. As we focus on positive affect, we have seen from psychological literature that this helps build hope. It builds resiliency and promotes really increased functioning. So focusing on positive affect and trying to feel better on purpose is not just something for the short term feel good. It actually seems to help us function better, and grow in this and broaden and build this way. So when we think about the positive practices that many of you might have been exposed to, it's going to be practicing gratitude, intentionally thinking about what you're grateful for. And you can do this just to yourself. I have a practice of doing it 2 times a day, in the morning when I wake up and I'm getting ready for my day, and at the end of the day. This really does help build hope. It helps build positive affect. You can do positive check-ins with people. This is, the shout outs to folks that we have around the hospital. We don't do those by accident. So the patient feedback from folks, the kudos jar, those sorts of things can be really helpful. They're not just little office gimmicks. They're shown to build resiliency through building hope and positive affect. So as leaders or teachers, remembering that. Catch people when they're doing something good. Say positive comments when they're deserved. Give positive feedback. It will help. It helps build hope. It helps build resiliency. It helps reduce stress. This is a big message. It's not just a nice thing to do. I mean, it is a nice thing to do. And it has a very salubrious effect on really reducing stress. So we can foster positive emotion, and we don't always think about this, but it's necessary, because as humans we carry around a negative bias with us, a negativity bias. Psychologists, physiologists, we've come to the conclusion over decades of research that this is hardwired into us. We attend to negative more than positive. Negative comments outweigh positive comments. For every one negative comment, you need multiple positive comments to offset it. It's not a 1-to-1 ratio. So that's why we need to actively focus on building positive emotions, because for most of us, that's not going to just come along naturally, even if we're living a good life, and certainly not if we're stressed. So we have to focus on what went well. Ask yourself, what went well this past week? How did the woman who interviewed do well in the interview? What part of some interview went well? Practicing positive gossip. So imagine that. Imagine saying something nice about someone to someone else behind their back. How wonderful to hear this positive gossip. So really trying to, if any of you are parents, you know this technique of catching them while they're doing something good. So often we get afraid to say something positive, or we're too stressed and we don't think about it. I'm encouraging you to foster that positive emotion for yourself. Build up yourself too. What did you do well? How did you handle something great? Did you get ahead of the curve on something? And celebrate that. Also celebrate it with those that you're working with. So to wrap up here, resilience in action starts from the beginning of what we talked about. If you remember back to the bullets, recognizing where you are on that stress continuum and identifying that. So that means you have to check in with yourself. You also want to recognize where other people are. You can do that better if you're centered. And then acting with compassion and concern to yourself. Cut yourself a break, be nice to yourself and to others. And then connecting. So as you observe and act and recognize this, really remembering to reach out to people, connecting with the resources you learned tonight, with the strategies you learned. Try some of them out. Try checking in with someone. Try starting, a little gratitude jar, or some positive feedback jar wherever you are. Really put in action some of this to help in that sort of resilience building. And of course, understanding where there are other resources. If you see someone who's over in the orange or red, familiarizing yourself with, how to maybe reach out for help and what resources there are. We have all kinds of them at UVA. And if you don't know what they are, reach out to me. I'd be happy to share with you, maybe a page of resources to have handy. So that's what resilience in action looks like. It's really can be incredibly powerful. I've worked long enough in this field to see this save people's careers in ways you can't even imagine, make their work more fulfilling, and generally make them a happier person, both at work and at home. So I really thank you for your time. I think we have left some time to take questions, and I'm happy to do that. I'll leave you with this quote that I love: be kind, for everyone you meet is fighting a hard battle. If we keep that in mind, that sort of wraps all of this up. Everyone you meet, yourself included, we're all fighting hard. We're here to do good work. And hopefully you've got some strategies tonight to keep doing that by reducing your stress and promoting resiliency for yourself and the folks that you work with. Thank you. I don't think I've had applause on a Zoom call, so this is pretty impressive.
I think it's about time, and I don't think everybody could unmute quickly enough, but you would hear a loud one. But welcome. We welcome everybody to unmute, and also perhaps to we know you're all at home, but you're welcome to share your video for a moment, since this is a family joined tonight, and we're open for comments. I'll say that very invigorating. We're all living in stress. Part of the message that I certainly hear is the need to have greater self-awareness, but to build a community of self-awareness so that people can, recognize when you're in the basement and how to get out of it, which is a challenge when, we get this kind of task-driven tunnel vision that we've been programmed for as physicians. So there's some really practical things to kind of to enhance that here. I think we'd all welcome that all those resources and even your tip sheet as well that that sort of float over me, but I want to be able to quickly pull out of my pocket or my phone in some way. And if you get them to us, then I promise to get them to everybody.
Absolutely. I will also say puppies are excellent stress reduction. So I see one right there with Evan. That's one thing I have loved about Zoom, especially these sort of evening or early morning ones where people are home. I get to see their pets. I get to see, the things that help them reduce their stress at home. So pets are wonderful.
Well, how many of us don't stop and sort of take a beat when you see some of the kind of the healthcare or service animals that walk through the hallways sometime? Mm. To me, that always takes me out of a particular space. Yeah. Right there. So it is that thing. It'd be nice to know what are those sort of things that you can do when you're not sure that you're in the basement, that you can kind of pull yourself out because people aren't around you. You want to leave us with, maybe a couple of things we can try in the next few days?
Oh, absolutely. Absolutely. I say, it is always good to have that on hand, exactly what you talked about, Siv. What will sort of bring you to your happy place, so to speak, and to, think about it over the next couple of hours and make it a little list on a card. It could be thinking about your puppy. It could be just taking a deep breath. It could be thinking about the last vacation you had that was so fun and wonderful. For some people, it's more auditory. It's listening, put your earbuds in while you're walking, across the hospital and listen to the music that will always center you and focus you. So it really is going to be unique, but the most important thing is to proactively remember to do it. And that's the hard thing. We all probably can name things that help center us, calm us down. Other things are, aromas. So some folks, if you are able to have hand cream or something nearby that smells lovely, to do that. Now, we can't all do that in the hospital all the time. So there are other strategies. People carry little sayings or quotes or something important to them. A button from your kids' pants that fell off in the morning that you now found in your pocket that's really helps you calm down. I've had people put little verses, inspirational quotes or something that they carry with them. They don't even have to pull them out anymore. They know they're there. And that's enough to help them sort of get to that happy place. And again, this is not just a trivial exercise of making yourself more happy. It is an active stress reducer. It is an active way to build resilience. And I guarantee you, if you take the time to do that with yourself, it's going to have a ripple effect. That's one of the best parts about it. Think about it, Siv. If you calm yourself down while you're walking across the hospital by listening to your music, you show up, you're feeling pretty good now, even though everything's falling apart around you.
It's the aura that people talk about that you get.
And then you're going to interact with someone, like we said, over on that friendly side instead of that hostile side. And that's going to start off a ripple effect. They're going to have their stress reduced. They're going to attend better. They're going to focus better. They're going to feel safer. And then they're going to spread that. They're going to do better work. They're going to communicate more effectively. So it's something that just grows. The most difficult thing is catching yourself. It's getting to that neutral place we looked at there, or just recognizing where you are on that continuum. This is why we focus so much on that. You have to attend. You have to check in, and that's the starting point. Once you know that I'm stressed, I'm in the orange, then you pull out one of your strategies to say, I'm going to try to get back down to yellow by the time I get to wherever I'm going.
How do you think about humor when thinking about this? Where is that, or is that
humor
problem,
can be,
perhaps?
Yeah, humor can be wonderful. The challenge is it can cut both ways. If you think about it, you can be humorous on that positive side, that green side, and it comes across as everyone's laughing. If, however, you use humor and you're over on the hostile side, it can come across as harsh or biting and be misinterpreted. So humor is one of the most sophisticated coping strategies, according to Freud. He called them defense mechanisms. So we know humor can be very helpful. It's just that you have to make sure, part of the challenge is humor builds more positivity when it's already on a base of positivity, if that makes sense.
Yeah, that's great.
Yeah. But a nice little joke that helps people feel safe, it usually works fine. I know I had the privilege of presenting with John Cleese, the comedian, the British comedian, and he said whenever he would present, he presents now, serious work about creativity and things like that, that he always tells jokes before, because he's convinced that helps people feel safe. Again, though, these are jokes that we can all share in. And so I think that's the important part is humor in that way that I'm pulling everyone in and respecting everyone, and collectively we're sort of laughing at the world, right? And that does help you feel safe, for sure.
So to some degree, it's difficult to hold group conversations here, and as time is sort of running short on this, is there anyone who wants to bring something up as well? Please feel free as we.
And I have not been looking at the chat. I don't know if there's anything in chat. Maybe not.
Affirmations of value of everything that you brought here, and thank you from people. So mostly.
So your mention of John Cleese, the tie into Monty Python, sort of brings a smile to my generation's face. I don't know. Evan, that you called out there with his puppy. He's visiting you from Dallas here, so he's zoomed in from Dallas. So.
Oh, wonderful. Thank you.
And we have a direct thanks from one of my partners who's said sort of spot on, really ahead here in this department. So I think that echoes everybody on the call as well. So unless there are any other closing remarks or any other comments, Alan, did you want to say anything to wrap us up?
Well, I think I want to thank Jen for being our inaugural keynote speaker. We're going to launch the series, and there's not a better way to start it with you. And I've attended a couple of your other sessions and learned each time and sort of feel, as Zeev said, invigorated by it. The positivity feels good in the world of negativity right now. So I think that's a way to help build resilience right there, just a sense of positivity and feeling empowered to maybe control things around you and your emotions a little bit better. So thank you very much, Jen.
Thank you.
My only closing request, since you offered, is that if we have the ability to use these, that we can come back to you and say, run some of these things again so we can look at how we're doing. All right?
Absolutely. Absolutely.
Great. Thank you very much, everybody. Thank you for coming.
Thank you. Good night. Good night.